The mechanical causes. The mechanical causes of the obstruction, adhesion, bands of the tissue forms after abdominal surgery. Hernia, a portion of the intestine protrude through a weakened area in the abdominal muscle or wall.
Herniation.
Intussusception, a telescoping of the intestine. Valvulus, twisting of the colon. Tumor, abdominal tissue growth.
Paralytic ileus. In functional obstruction or paralytic ileus, the intestine can become adynamic, which also means lacking peristalsis, from an absence of normal nerve stimulation to intestinal muscle fibers. It can also result from recent abdominal surgery, inflammatory conditions, electrolyte disturbances, decreased blood supply to the abdominal area, or the use of certain medications.
Pathophysiology. When the content in the intestine fails to move freely, the area of the intestine nearest to the obstruction becomes dilated and non-functioning. If the obstruction is not relieved, it can lead to intestinal gangrene, or perforation.
Mechanical causes in the small intestines are adhesions, hernias, that's supposed to be hernias, tumors, volvulus, intussusception, and inflammatory bowel diseases such as Crohn's disease.
Common causes in the large intestine: colon cancer, diverticulitis, a condition in which a small bulging pushes diverticulitis in the digestive tract becomes inflamed or infected. Valvulus, impacted phases, narrowing of the colon causes by inflammation and scarring.
Scarring.
Or scary.
It is scary.
Scars can be scary.
And that's an illustration of, we got it from Miss Tommy. So that's the obstruction right there, this one, causing either vomiting, the vomiting causes decreased electrolytes or hypovolemia. Your breath odor may become fecal, like it smells like fecal matter. Abdominal distension, constipation with failure to pass flatus, bowel sounds, increase the silent. I'll increase at first, and then when it settles, or later after the obstruction, it becomes silent. That's right there. High pitch at first, then go silent. I should have read that. Okay.
Good girl.
Signs and symptoms: small bowels and large bowel obstruction, paralytic ileus, pain, severe episode, and large bowel obstruction is moderate, more continuous, and paralytic ileus is not permitted. Vomitings and occur early may be projectile, occur that may be contain fecal matters, no prominence. Abdominal distension occur later, pronounced and present. Passage of the stool process minimal to none with partial obstruction of a large bowel. Diarrhea resulting from a liquid stool leaking around a partial obstruction, same as small bowel obstruction.
Complications: aspiration, obstruction which leads to electrolyte imbalance leading to shock, lack of blood supply leads to tissue death, leads to infection, peritonitis, short bowel syndrome as a result of multiple